So we obviously come from an emergency care background. So we've always worked in the ambulance setting, and now what we're finding is we're working in kind of primary care more and more. And the benefit of this role is we're now working in a clinic setting.
Mm-hmm.
So the way it works is that patients will phone up asking for an appointment, generally with a GP, and we're picking out that acute workload and we're managing that workload. So it's spread across essentially 2 clinics, one morning clinic and afternoon clinic, and then we'll typically have a home visit at the end of our morning clinic as well. So mainly we're seeing kind of minor illness workload. So generally people with same day issues or acute issues, so things that are short term. We tend not to be so involved in the chronic management, but obviously we see the exacerbations of those chronic conditions. So we're not a prescribing profession, so we can't prescribe medications. So the way we work around that in the surgery is we've built up such a rapport with the GPs that they now trust us, and we've obviously got a knowledge of kind of medications and things. So we'll print the prescription and then present it to the GP and have a discussion with them about the dose or the medication.
They're not a nurse. We need to refer to them by their proper titles, and they do have very different skill mixes than the nurses. The nurses are obviously great for our long-term conditions, doing all the general checkups and a lot of immunisations. The paramedics are sort of somewhere in between. They're doing your acute stuff, which is taking the pressure off the GPs for on the day emergencies.
But we've been really well received by the patients. It ultimately improves access. There's more clinic appointments for the surgery, so they're seeing somebody sooner. And often they just want to see somebody, and many of these issues are minor that can be dealt with, not necessarily even by a practitioner, but they're pleased that they're seeing somebody that takes an interest in them.